everyone. Myself, Dr. Vinodini from Chennai. I welcome you all for today's webinar hosted by Dr. Pente's Advanced Homeopathy and Research Center. There are few instructions for participants before starting the sessions. We request all the participants to kindly mute the audio and video so that there won't be any distractions while the session is going on. And this is a meeting, so we request all the participants to kindly rejoin using the same link after 40 minutes. And if you have any queries related to today's topic, kindly drop them in the chat box. We will bring up the queries at the end of the session, and we request the participants not to share their screen. So today's topic is homeopathic management in thyroid diseases. I would like to introduce our speaker for today. We have two eminent speakers. Our first speaker for today is Dr. Praveen Pente sir, who is the director of Dr. Pente's Advanced Homeopathy and Research Center. Dr. Praveen Pente sir has an experience of about 14 years in clinical practice. Dr. Praveen Pente sir has graduated in BHMS from PHMCK Kangon in 2005. Sir has completed a part-time master course at Athersong Academy from 2012 to 2013. Dr. Praveen Pente sir has completed a certificate course in advanced homeopathy in Athersong Academy from 2013 to 2014. Sir has also completed a fellowship course in advanced homeopathy at the Athersong Academy from 2016 to 2017. Sir has studied under many eminent homeopaths like Dr. Narendra Mehta sir, Dr. Rajan Shankaran sir, Dr. Jayesh Shah sir, Dr. Ajit Kulkarni sir, Dr. Rishi Vyas sir. Sir, thank you so much for sparing your time, for sharing your immense knowledge, sir. And I would like to share a few words regarding Dr. Pente sir. Myself attached to Dr. Praveen Pente sir's study circle group for the past few months, where sir used to share immense knowledge and his understanding regarding various topics, which is very much beneficial to day-to-day clinical practice. So we welcome all the participants to join the study circle group so that you will become much more benefited. So our second speaker of the day is Dr. Shakeel Noor Muhammad Mulani sir. Dr. Shakeel sir has completed BHMS in 2003 from Satara Homeopathic Medical College. Dr. Shakeel sir also studied with Dr. Asif Chunawala sir, who is a direct student of Dr. Muzamdar and Dr. L.M. Khan for 2 years. Dr. Shakeel sir has completed FCAH in 2016 at Athersong Academy under Dr. Shankaran's guidance. He has also completed PG FHPC 2020 at Athersong Academy along with Dr. Mahesh Gandhi sir. Sir has underwent a certificate course in mesotol therapy from 2007 to 2008. He has studied along with Dr. Farooq Master sir and Dr. Suji Chatterjee sir. And sir has an immense clinical experience, about 16 years of clinical practice. Sir has also worked ex-honorary consultant at Millet Multi-Speciality Hospital, also worked as honorary consultant at Charitable Foundation at Karjat. Sir, thank you so much for accepting the invite, sir. It is our pleasure having you at today's event, sir. Now, without any further ado, we'll turn over the time to Dr. Pente, sir.
Thank you so much, Dr. Vinodini. I request you all, please mute yourself. Mr. Firoz, Dr. Firoz. Yeah. So welcome you all and the warm good evening. Welcome Dr. Rishi Vyas, my mentor is also here. Welcome Robin. Welcome Dr. Soni, welcome Dr. Firoz and all the participants who are here. So today we are going to discuss a very interesting and very common topic for every clinician. So today we are going to discussing about how we can manage all kinds of thyroid disorders or thyroid diseases basically. So first 40 minutes I'm going to talk, and later on Dr. Shakeel is also going to discuss some clinical cases with you. So I think everybody is excited, so let's start. So today in our session we are going to...
Sorry for interrupting, sir. Sir, I have mild breakage in audio, sir.
Okay. Okay. Even now also?
Sir, yes, sir. It is better now, sir.
Okay, fine. So today we are going to understand the pathophysiology about the thyroid gland. Other than what are the causes behind thyroid disorders. Then we are also trying to learn about some clinical understanding, some remedies which can be used mostly in thyroid diseases. Other than that, we are trying to understand the types of thyroid diseases. Then we have a very interesting and beautiful case of a small girl with hypothyroidism. Her TSH level was more than 150. So I hope everyone is excited. And okay, so what is basically thyroid gland? We must need to understand what is there in the thyroid gland, which helps us to maintain our, all the hormonal balance. So basically, in thyroid gland, there are two types of hormones. One is thyroxine, and one other is triiodothyronine. So, what is the role of thyroxine and triiodothyronine in our body? What is their basic action to understand, clinically? So most of the time, what happened? We used to take the clinical symptoms or the disease symptom as a rubric. But that's why I'm going to try to make you understand what is the basic role of thyroid gland. So T4 and T3, they both are very very important. They both comes into the bloodstream and they regulate our metabolism. They also use the fats and carbohydrates to control the body temperature and the heart rate. So now you can understand, once there is a disturbance in T3 and T4, then there is a heartbeat increase, there is a palpitation, there is a gabrat feeling, there is a kind of swelling all over the body. So these are the disease symptoms. Along with that, T3 and T4 also helps us to maintain our body temperature, and also they influence our heart rate. Okay, so what it means, what it means, this is also important to understand. So if the patient comes of a hyperthyroidism or hypothyroidism, if they have a mild continuous fever, it means not that they have a fever. Okay, so T3 and T4 helps us to maintain our body temperature. Other than that, the main important role of T3 and T4, they regulate our the production of protein and also the release into the body. So this is so important. Also, T3 and T4 produce and release the calcitonin for what? To maintain the calcium level in the blood. Okay, so this is the basic normal anatomy and the normal functioning of the thyroid gland here. But now, what is important? Who is there who is going to maintain the thyroid gland? Who is going to maintain the regularity of thyroid gland? Everybody knows that nothing but about the pituitary gland. But my dear friends, there is not only the pituitary gland. There is also one important system or one also important part in our brain that is nothing but a hypothalamus. Okay, so pituitary gland and hypothalamus, they both are come together, and with their understanding they release the TSH, and from the TSH they have no now the thyroid stimulating hormone regulates the T3 and T4. Now you understand, if there is a disturbance in T3 and T4, then there is a problem. If T3 is reduces or increases, then there is a problem at the heart level, liver level, bone level, and the sinus level. And if something happened to the T4, then there is a problem into the liver and the muscles. Okay, so why I'm telling you, because if something happens to this, okay, so if you try to understand in hypothyroidism patient, there is the myalgia, there is a heaviness in the body, there is a overweight, there is obesity, quite palpitation and the gabrat feeling. Sometimes they may be feeling hoarseness of voice at the morning. Okay, and now, which is very very important to understand, most of the modern science doctor prescribes only the thyroxine tablet in hypothyroidism. That is not nothing but an hormone. That is not a treatment, by the way. Okay, so this is the basic understanding that hypothalamus and pituitary is going to control the rate of production and the release of hormones. That is nothing but a thyroid stimulating hormone. So now, once we try to understand, once we are going to go for a reports of thyroid, like kind of a thyroid profile, and we understand there is a TSH increases. Am I right? So, or sometimes there is a T3, T4 increases. So according to the level of hormones, there are different systems. But once we need to understand the HPT axis or HPT system or HPT cycle, that is nothing but the hypothalamic pituitary cycle, hypothalamic pituitary thyroid cycle or axis. So everybody knows that hypothalamus is there to regulate about the thermostat of the body for the whole system, and that hypothalamus gives some signals to the pituitary gland to release the hormone, and that hormone is nothing but the TSH. So it
Yes,
means
yes.
if there is something happened to TSH level, it means not it's a problem of thyroid gland. Try to understand. Okay. If there is something disturbance at the TSH level, it's not only because of thyroid gland. It means that there must be disturbance or there must be an imbalance also at the pituitary and also at the
And all
hypothalamus gland.
hypothalamus.
Dr. Meenakshi, please mute yourself.
Yes.
Mute yourself.
Okay.
So that pituitary gland release the certain amount of TSH. See, the certain amount. If it excess, then also problem. If it reduce, then also problem. Okay. That TSH will decide how much T3 and T3 and T4 should be needed in the blood, and then only whole hormonal regulation can be understood by the body, and that will be the kind of a synchronization or a harmony at our hormonal level. And if there is any kind of a disturbance in our body, then there is always a endocrine problem. So why I'm telling you, because before going to understand the disease level, you must need to understand the normal physiology or normal pathophysiology or functioning of the thyroid gland. Also, not only the thyroid gland, also the pituitary, also the hypothalamus. Okay. So once there is a disturbance at this HPT cycle or HPT axis, hypothalamus pituitary thyroid axis, there is that can produce an endocrine disease. So this is the first and the most common etiology. I'm talking about the etiology or the cause for any kind of endocrine disease. Once there is such problem in HPT level, then it can also cause the problem at adrenal gland, and that can be because of there is the myxedema, there is the Cushing syndrome, or there can be a nephritis, because adrenal gland helps to maintain the renal hypertension, because there is one system, renin angiotensin aldosterone mechanism, and that is very necessary to regulate the our renal hypertension, and that renal hypertension, hepatic hypertension, and our portal hypertension maintain our body system. Because if something happened to this, if something happened to endocrine problem, the first action will be on heart rate, because these hormones helps to maintain also the heart rate. Okay. So then what is the cause, what is the problem behind this? What are the other etiologies? So other etiologies are like hyperfunctioning of the HPT system, nothing but a hypothalamus, pituitary, and thyroid system. If there is hyperfunction, then also problem. Okay. The most common cause is iodine deficiency. This is the most common cause. I request everyone, please mute yourself. Then another common cause is Hashimoto's disease. Sometimes there can be a multinodular goiter, and nowadays which is common is that a thyroid cancer. Okay. In our clinical practice, if the pregnant woman comes with the hypothyroidism or thyroid problem, then you must need to understand there must be a kind of a disturbance in SCG level. There is kind of a gonad dropping hormone. Okay. And one more thing, clinically, I would like to discuss here. Every thyroid or every thyroid case is not a thyroid case. Every hypothyroidism is not a hypothyroidism. There must be another cause at the PCOD level. Okay. So if there is a disturbance at the progesterone, prolactin, LH, FSH, that can be caused a hypothyroidism or a TSS level. So it means not that every time your thyroid gland is a reason for a hypothyroidism. So that time you must need to go for a blood test called a PCOD profile. If there is a PCOD, if there is a kind of a late menstruation, if there is a fibroids, or if there is a hirsutism, if there is a Graves disease, along with this TSH profile, you must need to go for a PCOD profile. Along with the thyroid profile, you also need to go for a PCOD profile. This is a blood test, not a USG of polycystic ovarian disease. Okay, so this should need to be understood. So now we understand that thyroid gland is regulated by the hypothalamus, pituitary, and all that. Then what can be the cause? What can be the cause behind an endocrinal problem or a hormonal disease or a thyroid disorder? What is the cause? As we know that there can be a bacterial viral cause for COVID or kind of a fever, or if there is a gangrene, there can be a staphylococcus or bacteria or streptococcus kind of bacteria. Then what is the cause for thyroid problem? That must be known. Because I always tell to my people, why is very important. You must need to understand why behind each and everything. If you don't know why, why there is a overweight, why there is obesity, why there is a palpitation, why there is a puffiness in a hypothyroidism, then you can't understand. Otherwise you will take that symptom as a in your repertorial chart and you will get misguided. Okay, so you must need to understand what is the disease symptoms, what is the clinical symptoms, and what is the what are the symptoms to the in the patient, which is very very important. Because disease symptoms can be common, but into that common symptoms how patient behaves, that is our PQRS. In that common symptoms, in the disease symptoms, how patient reacts, that is very important. You try to understand both the polarities in the case, then and then only you can understand what is happening in the case. So I would like to tell you that in every case of endocrine problem, or in every case of thyroid disease or hormonal imbalance, there is a cause at the there is a cause at the central disturbance, TCD. The central disturbance is very very important. Only the central, the the harmony at the central level is the that can maintain the synchronization or can kind of balance of vital force. If there is a disturbance at the central level, then the problem starts. And most of the time we never consider the central disturbance. We try to treat the disease only. We try to treat the gangrene, we try to treat the eczema, we try to treat the rheumatoid arthritis, we try to cure kind of any other things, any other problems. But what is important in homeopathy? Now I'm coming to the homeopathic part. We have covered the allied part. Now we are coming to the homeopathic. So in homeopathy we have to treat the central disturbance first, not the pathology, not the disease. Okay, try to understand what is the central disturbance, how the central disturbance regulate, how 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 we can maintain the central disturbance. Okay, we can maintain the central disturbance with the balancing of this P and E level, this P and E axis. So psychoneuroendocrine immune system is very very important to maintain the body function, to maintain the your all the system. If something happened to the central level, that can cause disturbance at PNEA level, and that PNEA level is going to harm or is going to disturb your all the body parts, your all the internal system. It can be a thyroid, it can be heart, it can be a renal problem, it can be pancreas, you know. So this is a cycle, and once there is a disturbance at this level, then there is a problem at the your bloodstream, at your blood level, and then the problem starts. And in this condition, which is very very necessary, how the patient reacts, how the human will react. So that's why Dr. Haniman told us we need to treat the man, not the disease. Okay. So why I'm talking you, why I'm telling you these things, because most of the into the thyroid cases we try to take only the disease symptoms, but you must need to understand what is the disease symptoms and what is the problem, what is not. Okay, so this PNEI axis, this PSEI, PNEI level is very very important. Okay, so if something happen at your psychological level, if there is any kind of a psychosomatic cause, that can also cause you the hypothyroidism. So what is this, how to understand this? So when, this is very very important, when you fail to cope up with these stressors, when this PNEA disturbs because of stressors. So what are the stressors? Stressors can be anything. Okay, and if you have failed to cope up with the stressors, if you fail to cope up with the fear, if you fail to cope up with the anxiety, if you fail to cope up with the anger, if you fail to cope up with any kind of a mental stress or any kind of a problem with creates the problem at your PNEA level. Okay, then the problem starts. The coping up mechanism is nothing but a miasm, by the way. So how you are maintaining yourself, your miasm is going at a failure side or your miasm is going on a successful side. It depends on you. Okay, so this is very very important. So what happen at central level? So at central level you are self means you are as a whole. And if something happens, if there is any kind of a problem, then the thinking starts at the mind level and at the intellect level. Okay, there can be love disappointment, there can be betrayal feeling, there can be a insult, and after that there is a thoughts and the feeling. So what do you mean by thoughts? Thoughts mean nothing but an imagination. We went into the delusion, why he do this to me, there can be a my mistake, or why he this to me, then I will take a revenge, so why he this to me, it affects me, then the imagination starts. And with that imagination you react with the feelings or the emotions. And because of overthinking, because of more using of the brain, and if there is a because of disturbance at the PNEA level, then the endocrine and the central nervous system problem, and that affects your immune system, and because of that affect your system, then your body reacts in the form of disease. This is not only considered only for the thyroid problem, this is for all. So in your case checking, try to reach at the central level, from where it start, how it start, because other symptoms are the kind of a bridges to take you to the selection of remedy. Okay, but you must need to understand the etiology behind it, from where it start, why is very very important in homeopathy. Okay, so then what can be stressor? So what happen after the stressor? So that stressors can create a disturbance at hormonal level, at immune level, at endocrine level, and then the problem starts. What Dr. Heyman told, the basic delusion is nothing but a disease. Okay, so basic delusion, the delusion can be at positive level or delusion can be at negative level. That delusion is a disease, nothing but disease. But when it happens, when the delusions comes, when that thoughts comes, when that imagination comes, that comes once there is a disturbance at the central level, and that disease can cause you disturbance at the vital force, and once there is a derangement of vital force, means your body will going to affect. Am I right? I hope, I hope so you are there. So what we are doing in our homeopathy, we are trying to understand the basic genius in the case. We are trying to understand the thread all over the case, and along with the case we are trying to understand the match of the symptoms and the system. Okay, so we are trying to understand this synergy. Okay, so this is very very important to understand each and every disease, and also normal functioning, also the physiology. Then and then once you can understand the pathophysiology behind the disease, then you can treat then you can treat the case very well. Okay, so now you understand why PNEI is important. And this is not I am talking, this is all are talked by the allied science. They believe in PNEI axis, they believe in the stressors, they believe that stressors can disturb your endocrine and immune system. So along with this, now we have a very beautiful case of a small girl. Okay, so let's try to understand why these 9 years girls develop that kind of a TSS level more than 150, and she developed the colloidal goiter. Am I right? What is the cause behind this disease which makes the disturbance at central level, and that central level disturbance reduce causes the imbalance at the hormonal level, hypothalamus pituitary thyroid level, and then causes the colloidal goiter. Her report on 29th July 2017 was more than 150. So I rechecked the same report again in a thyroid care lab. That was also more than 150. So because of that swelling on the neck region, I advised them to go for USG, and doctor advised there is a suggestion of goiter. That's most probably commonest goiter is colloidal goiter. Am I right? Okay. So what we need to understand, all the examination, investigation, not only one time, you have to recheck it again, because this is a very very rare. No, at the 9 years old, how can this happen? So most probably hypothyroidism happens after the puberty, or after the marriage, or into the middle age. But at the 9 years girl, this has happened. So we must need to consider it. We must need to recheck it. Okay. So in this case, which is very very important, is that her parents noticed that she became more dull and more sluggish and more slow since few months, and she was like weeping all the time. She became more sensitive nowadays, so that's why they consulted their local doctor, and that local doctor diagnosed it as like a hypothyroidism. So parents said previously she was absolutely right, but because of due to since few months she become more sensitive, her mood like swinging, she become more irritable and angry and cranky kind of a girl. So once her parents try to make her understand, she become more angry, and they run away into the room and weeps alone. And that time she doesn't allow anyone to come in her room. Okay, so this is all are the reaction. This is all are the happening in the case. Okay. So once you try to console her, or once you try to make her understand, she become more abrupt. She hastily replied us. She never understand who is in front of us. She replied anyone abruptly to others. So I asked him how it starts. Why this happened. The parents said at is there is no access region behind it. But in the observation, I was finding something new. So I advised them, go and can you please wait in the waiting area? Let me talk to her in person. So there was a big silence, and I asked her only one word. What happened, beta? क्या हुआ आपको? This is a single word I asked. What happened, beta? And there was a tears rolling down from her eyes, and there was a big silence. So now try to understand the depth of the disease. Try to understand the depth of that central disturbance. I ask her only one word. What happened, beta? The beta is very important word for her. I will tell you later on why. So this is very important. There is a big silence. There was only the tears from her eyes. Okay. So she said, my parents always scold me. They used to love more to my younger brother, who is 5 years smaller than me. They always love more to him, and that's why I feel more and more jealous about him. But I could not tell these things to anyone. Most of the times in childhood, my mother used to give more attention to him. Try to understand where is the disturbance. She is not that much caring towards me as before, but previously she was more and more caring to me. But now she is not that much caring to me nowadays, because my younger brother is there. Even among the friends, Vedika, her friend, she also do katti with me. Katti means she is not ready to talk with her, and she always said that you are not a good girl, you are not a good girl. Okay, so they said that everyone is so bad to me. Why they are behaving like me? I also don't know, because might be because I'm not a good looking, might be because I'm not a good girl. So all the time she's weeping, all the time she's weeping. This is happening, and during that tears there was a sobbing. There was a like sobbing. So this is very important to understand what is the depth of the disease. Okay, depth of the disturbance. So she said, I tried to score very good marks in the school, but I always fails. I can't go up to the extent or kind of level of my father expectation. So I feel that I am not a good enough. I am not a good looking. That is my problem. So I ask her, what do you feel about your brother? So she feel, I feel always angry about him, but I can't do anything to him, and I never share this thing to anyone. You are the first person to whom I share. My parents always ask me what happened, but I never tell him that this is happening with me. So I always weep in alone, because my mother love him more than me. That is the issue. And then I feel also feel angry about my parents. And so that's why whenever they used to ask me what happened, I used to shout on them. That is also another reaction of the patient. Okay. So I asked her, what will you do? So she said, once I become a big person, I will do the good studies, and then I will become big. I will become a clever. Then everyone understand me. Everyone recognize me. She's talking about, So in dreams, she has a very peculiar dream. So now understand the polarity. At one time, she is not good enough. She is not good in studies. But in future, she wanted to be a big person. She has a dream that I will like a first in my class. I have a first rank in my class, and then I will become a doctor. I will become a collector. Wanted to become a big doctor, so that's why I can serve the people. I can serve the society, and then people will remember me. It's a very simple case. Then another fear of ghost. They will take me away from my parents. Fear of dark, fear of alone. These are for spicy pickles. She's a thirsty, aversion to sweet. Very remarkable. And patient is hot. So now we need to understand in this case, you know, what is to be cured in the case. So we have to treat the thyroid, we have to treat the goiter. No, we have to treat the central disturbance. We have to treat the PNA axis. So there was no love, there is no care, there is no motherly attention as before. And that's because of the stressors, there's a disturbance at the PNA axis, and because the PNA axis reacts in the form of at endocrine level, there is a hyperfunction of TSH and hyperfunctioning of the hypothalamus, pituitary, and thyroid gland, and that's why their TSH is high. And into the reaction at immune level, she has a constant fever. She develops the goiter. That is the reason. Okay, and then we need to understand what is the central disturbance here. The central disturbance is nothing but not having a love, not having a care, no friends. There is no friends, no attention as before. And what is the reaction to that? Anger, abruptness, harshness, weeping, desire to be alone, aversion to everyone, shouting on others. That is her reaction. So this is nothing but that central disturbance creates the imbalance at the PN axis, and that is going to cause you the hypothyroidism. Okay, we have only 6 minutes, we will cover it. So how to understand it homeopathically? How to understand it? So once we try to understand at synergy level, the one thing is very very important, that she has accepted that I am not a good looking. Why this happens to me? Everybody scolds me. Vedika is also not allowed to play me. You know. So the one thread is there, unfortunate feeling. Why this happened to me? That is the genius. And as per the system level, you try to understand there is lacking in me. I am not scoring good. I am not good looking. They are not loving me. I want to become a collector. I want to become a doctor. Mother is not loving me. Mother is not taking care as before. So there is the issue of lacking in me. Issue of image conscious. Issue of care nourishment. Issue of alone feeling. And that is nothing but the mineral kingdom, third row. So at symptom level, you try to understand there is a goiter in children, which is very, very rare. Okay, and she becomes jealous for her brother. She feels that my parents don't need to be love me. She become more for second for them, which is not mentioned in the case, but this is the observation. Once I ask her what happened, beta, and then the tears roll down. So now you understand, since 5 years she has the problem because of brother, but she never shared this problem to anyone. Okay, so when that weeping and sobbing comes only after the grief, there is a so deep grief to her, you know. So this should be understand why I'm talking you like this. So here is no any kind of other symptoms of thyroid disease. Okay. So now if you try to understand at repertoire level, so there are few rubrics: neck goiter children in the mind section, for second feeling loved beloved by his parents, friends, feel is not being, consolation aggravation, jealousy in children, which is very very important. Most of the time we feel that it's the issue of me versus you. It somebody can tell it's ignitia, somebody can tell it's a tarantula, somebody can say it's something another remedy. Okay, but here more is about I am not good looking, I am not good enough, I am not able to score more marks. That is the issue. Okay, then the fear of ghosts, fear of dark, and all the symptoms. So why I take this mind rubrics, because this is nothing but a central disturbance. That central disturbance creates the problem at PNEA level, and because of PNEA level, that creates the problem at endocrine system, and that why the goiter is there. So it's not necessary every goiter patients develops the hypothyroidism or thyroid symptoms. This is not there. So in maybe in might be in multinodular goiter, there is no any kind of a problem. Another important, if you go to try to understand goiter neck, grief after, see the grief after, 4 mark remedies nitromureticum is there. So after prescribing nitromureticum 1 m in repetition, she did very well. Okay, so this is her first picture in sorry, this is her second picture after follow up in October 2017. Then it comes in 18 May, and then in July. So within a 1 year, she is absolutely right. Okay, so not having a goiter is not only the reason, not only the treatment. We must need to understand and check her thyroid level. So the thyroid level, which was one more than 150, after that it becomes 6.72, because that patient comes to from the 200 kilometers away from my place, from Maker. So her then 6.72, and afterwards it becomes 5.30. Till then there was no any kind of a thyroid level increase. And my dear friends, I would like to address one thing: you have to stop all kinds of anti-thyroid treatment on the first day of consultation. Okay, and that is now, see, after giving atomor, even today, this is her today's pictures. There is nothing, no any kind of a goiter. All the reports are normal. She started menstruating normally. There is no mood swings, there is no any kind of a sluggishness. And at the summarize, because we have a not too much time, so this is the lesson for today's case. Not only the today's case, in every case, if you are going to treat them homeopathically, try to understand the central disturbance, because we have to treat the central disturbance, not the pathology. Okay, so in every endocrine case, try to understand what is happened at her or his mental level. Okay, so this is the case, and I hope you learn, you get something important from this. If you have any query, any feedback, please give the mail. And we always used to go for Friday and Saturday Zoom session. So here we have a team. If you are from Europe region or from Canada or somewhere else, you can contact Dr. Smita Annabelle. If you are from Pakistan, you can contact Ehsan. From Gujarat people, they can contact Dr. Asif. From Chennai, Karnataka, they can contact Vinodin, and Maharashtra, Dr. Vijay is there. So be there with me. I hope so. We will come with the more interesting sessions like fever, like acute, like pathological cases. So we will go with this, with the disease wise, also along with the therapeutic level and other level. So in also therapeutically, if there is problem in hypothyroidism or Graves disease or myxedema, try to think about the remedy which have the dwarfish child like Baratacarb, like Calcarea remedy, like Muriticum group, like iodine group. Also, one of the good remedy for hypothyroidism is Bufo. Bufo is also very good important remedy. Other than that is thyroidinum, cortisone. So these are the which are the remedy we can use also therapeutically. But try to understand more and more at deeper level. Where is the disturbance at the central disturbance? So we are going to rejoin again because it's a rejoin meet. After this session, Dr. Shakeel is going to share his interesting cases of thyroid cancers and other critical cases. So I hope we have 57 people. So rejoin again. This is my request to you because Dr. Shakeel is from Mumbai. He's a very good practitioner and he has interesting cases. So be there. We have to rejoin on the same link, by the way. If you have any query or any problem or any feedback, please mail me.
Where like yeah, so advanced pathological cases where we cannot get the whole totality of the symptoms. Like I'll just share a case with you where we really don't get anything. Sometimes people listen about you and they directly come. Okay, so there is a big problem. So I'll start directly with the case. So this is a patient, 76 years, female. Now from this case, no, I learned few things. I learned from my mistake. Okay, how prognosis should be done in homeopathy. So I'll just share the first part of the case. This is where I made some mistake, and then I'll when we see the totality, then what comes to your mind and what remedy does from your side. It's wonderful. Okay, so for me, just this is a case of 76-year female. So she came to me in April 19th with left carotid stenosis, and digital subtraction was done, like ballooning was done, hypothyroidism, chronic atrial fibrillation, hypertension. Then there was a history of paralysis on the left side, and then after on the right side also. And then she recovered also with some physiotherapy and all. So this patient did not come directly to me. Please go to next slide. Yeah, on modern medicine, she was on all hypertensives, anticoagulants, diuretics, etc., etc. You can see in such. And this patient was not accompanied. I'll just show you her video later on. So her daughter, she was now. I'll start with the case. Next slide, please. So the patient was bedridden and no direct history was available. So the history was with three people. So visitors who visited frequently since she is an aligned position, sister-in-law and daughter attendant, the person who used to take care, that too part-time, only in the afternoon she used to come and she used to be there in the evening for diaper change and all. So, and her daughter-in-law, who is already a widow. Now the story is very important. She's a widow. She was a very widow at a very young age, and this lady who was bossing this daughter-in-law did not allow to get married. So she had one son, one daughter. So you understand now what sort of totality we are going to get. So visitor is not 24 hours. Okay, she's been the daughter came and her one accompanying relative came, and so what about the totality now? Where to look for the symptoms now? What about the individualization? Whom to trust for to collect the symptoms? Since this is a daughter-in-law, she is at a very young age got widowed, and I'll just later on when I'll be questioning, just feel the patient, because I could not take the video of this case because it was not direct patient, so I could not share a video, but just feel the patient, where you have to depend on for the totality. You have to depend on someone whom you also cannot rely. You cannot rely, so you have to put all your skills together and just be there with the patient. Okay, you have to have a genuinity that you should come, you have to help this patient anyhow. Next slide, please. So, but still, just look at the case, what we can do, and now start collecting the symptoms. This was the basic, the patient came, sat with all the reports. Okay, she was hospitalized for 3 months, at an interval for 3-4 months, again and again. So all the 2 years history, full bag of, and no patient and three sisters. This was the basic which I gave you. Now I thought, let's just see if the patient is not there. I have 1.5 hour to sit with. So let's just start see what I can do it. Okay. So I just started collecting the symptoms. Next slide, please. So the complaint was, the first attendant gave the complaint: the skin itching at night, sleepless at night, skin is itching. And the second son, who is abroad with the family, he does helicopter caretaking. Like, what is helicopter caretaking? It's like from just phone call and ask the first people who are attending her कि ये दवा हो गया क्या, ये कंसल्टेंट से बात हुई क्या, ये हॉस्पिटल में विजिट हुआ क्या, ये रिपोर्ट्स हुई क्या. And just, so it was a big concern. After 30-45 minutes, he also called me on the phone to talk to me, because they were about to come to me. So this was first set of symptoms which I got, and of which the important data was she was better with a good physiotherapist whom they visited, and she has been recovering very well. We'll see in the video later on. Next slide, please. Now, second relative or second person, I said three souls. Among them, second started talking. She said ki she's talkative. Phil, things are talking to me, you're talking to me, and I'm replying. Means she said कि वो लोग बात करते हैं, मैं बात करती हूँ, मुझे ऐसा लगता है वो मुझे reply करते हैं. This was I. Then I questioned her. So to know that whether she was in a conscious state or unconscious state, better understand this. So I answered. Was the answer clear, or whatever said was understood by near one? So what she said, a beautiful answer. So she said कि कौन सुनता है, who listens? Okay, we are just here to. She always keeps on talking. वो बड़बड़ाते ही रहते हैं, परेशान करते रहते हैं, रात भर सोते नहीं है. ये दो, वो दो, पानी पिलाए क्या, दूध दिए क्या, fruits दिए क्या. So this was the answer which I got. I thought something important would come, but unfortunately this was the answer. So she said we don't listen to it, but still it is confirmed that वो बड़बड़ाते रहते हैं. And the talk is not very clear or clear. We don't know. Means she could not answer that question because they don't listen to her very carefully. Then she spoke about the appetite herself only. She says कि every food she gives smells. Whatever we give, she says कि इसमें मुझे smell आती है. Thirst is very less. Then I confirmed about the thirst. She said
Dr. Vakil, can you mute yourself, please? Dr. Reni Vakil, please mute yourself, and Dr. Nilima. Yes, go ahead. Dr. Shakeel.
Thank you very much.
Yeah.
Thirst. So about thirst, the patient directly said, the attendant said, we don't give much of water because then we need to frequently change her diapers. Okay, she's in a bed. So agward and stool and urine again in a diaper. So who knows? This was the answer by the second one. Next slide, please. So the attendant, one more attendant said कि memory is weak. She forgets the thing to do or to be done. So I said, very important. Now I suppose I will get some good symptoms from here. So I said, how her memory is weak or she forgets thing. So the answer was, दवा खिलाए तो बोलते हैं कि दवा और दे, खाना खिलाए तो बोलते हैं खाना और दे. Means we have given the medicine already, but she asked for the medicine again. We gave her food and she asked, we give the food and she says कि give me food again. At the age of 76, you understand what she might be doing, what to take, whether this is a common symptoms, whether this is an uncommon symptoms. You have to categorize this thing. This is very important. Okay, same with the medicine, same with the massage. Okay, things she tells to do have already been done. कि वो वही काम करने बोलते हैं जो हमने already किया है. So again, you see what answer she gives. Okay. Next. Now about sleep, I just went in a bit little detail. So she said ki, she is taking a sleeping pill which works in the morning, so she sleeps till evening in the day, and the sleep is very good, and the night is very sleepless. So can you ask the dream in such a case? And past history mein she has been operated for prolapse of intervertebral disc few years back on the back, and she has recurring joint complaints since very young age. Okay, next slide please. So then I saw I nothing specific I was able to get from the case. So just I went to the reports. There was a multinodular goiter finding suggestive of colloidal goiter, and her T3 T4 this levels were there. TSH was little bit less. She was on methimazole tablet in allopathy, and her creatinine was serum creatinine was 2.5. Now I asked them, why, what is the reason you have come here, what you need to help. तो they said कि सर creatinine बढ़ता जा रहा है तो फिर डायलिसिस होगा, तो आप थोड़ा डायलिसिस के लिए मुझे हेल्प कर दो हमको कि उनका डायलिसिस नहीं हो पाए, तो बड़ी मेहरबानी होगी. तो I just went a step back and I thought over the case, what can I do. So I just took a repertory. I repertorized few symptoms. Next slide please. Yeah, next slide please. So these were the rubrics: skin itching at night, paralysis. Uh, now the itching was more was still until it breeds, and hyperthyroidism. So as Dr. Praveen said, ki Baraita is also one of the good remedy. Think of it. The first case comes with the Baraita. So I gave Baraita TDS for 15 days because she was in a state. So when the patient is in a state, we repeat frequently. So I gave. Next slide, please. So creatine was 2.5. Review the condition. General condition is the same. Now we have to analyze the case because it was not very confident. Na? The prescription was not very confident. So should we rethink or continue the same? So I just went for to go with the same. Okay. Next slide, please. This was on 15th June. Then after 1 month, she came to me. The attendant came to me, the daughter and the sister-in-law. They came to me. So sleep was much better, but in divided in parts. That is means night sleeping was bit increased and day sleeping was little bit better. She stopped talking, whatever she was talking. So I was just astonished whether they are paying attention to her or not. So this was a question mark in my mind. I asked them, how do you know that she has stopped talking? Now she is talking repeated. Now she is not asking repeated things like whatever she used to ask for medicine, what to food. She is not asking. Okay. So she has become more quiet, more stable. Her night sleep also has been increased. So she's sleeping well. So she's not troubling her daughter-in-law who is to take care at night. Okay. So now again, rethink about the prognosis. It is good or bad? Is the now when the patient is improving drastically, you have to rethink the evolution. As Farooq Master always says, cure should be gradual, not sudden. If it is sudden, then it's not good. You have to rethink your remedy. Might given a partially similar remedy, or your remedy might be some problem with your remedy. So I just rethought my case. The general state deteriorating or better. So I got a good answer. And then next slide, please. And to support this, there were the reports. To support my thinking, there was a report. Her creatinine came down to 1.7 and TSH was improved. I was very happy. After 2 months of treatment, everything is normal. So I then started with SL. Okay, the best remedy. Her general state is improved. Next SL for next 1 month. Okay, because for me it's good. Everybody is happy. Creatinine from 2.5, 1.78. Though at the age of 76, below 2, everything is good. 2.5 is also good. Okay. Next slide, please. So the next remedy, a slide before. So SL for 1 month. Yeah. Then after that, next slide, she came to me on 15th July 2019. Her creatinine bit better, 1.53, and HB is 8.7. Okay. Next slide, please. Again, approximately. Now, this was very good till December 21st of December, all SL, and then she was much better. And in between 10-12 months, she left the treatment, no call from her, and everything was better. Okay, no remedy was given. And all of a sudden on 21st December, the patient came to me on 2020. I suppose 1 month back. Same case comes for after approximately, the patient is old. Again, no patient. So cannot come. and only daughter came to see me with the reports. Now, what the learning process for me was, if my first remedy was right, if my first remedy was right, the patient should not have come for the same problem again. Okay. Now, when you see the video, you'll understand what she came for. Okay. So, um, next slide, please. Okay, this is a video.
Dr. Raki said no.
Oh, it is asking to end the meeting and leave. Okay, I'll just share it. Okay, the goiter was so such enlarged, and it was like, the whole size was increased. Okay, and this much, and no other thing. She was not able to talk, and she came to me directly.
Yeah, you have to make me host again so I can share the PPT.
By any means, videos can you share later on, because it's wonderful seeing the video.
You haven't sent me the video. You have sent me only PPT.
Oh,
Shakeel bhai.
okay. To make you host.
Yeah, please make me host. Go into the participants.
Yeah.
Click on my name more and make me host. Yeah, thank you. Yeah, back to the case again.
Yeah. So here you can see such a largely enlarged this multinodular goiter, and this was the reports on 7th of December 2020, after 1 year when she came to me. See, her TSH is more than 147. Okay. Now the first thing, what came to me, as Dr. Praveen rightly said, he stopped all allopathic medicine. I did the same in this case, and the medicine was stopped, and in the evening they went to the allopathic physician who was taking care, and the physician himself stopped the allopathic medicine first, at the very first instant. Okay. Then after some time, then we just try to understand the case now. Okay. So symptoms given by the daughter. Next slide, please. The symptoms given by the daughter is fingers cannot do anything, they are numb, speech is very slurred. So this much was only available. And I asked her more. The doctors insisted that, doctor, you give the same remedy. Her kidney was doing well. She was doing well. Her thyroid was well. Don't ask many questions. Na? You give her the same remedy. So can we give the remedy? The question comes again to the mind. If I give the right remedy, would this disease would have been come again? Okay, because thyroid that time also was only the levels were normal. Okay, and we did not see into the case. We did not got there, or we did not took videos of that case. But at that time it was not visible as multinodular. I had some videos, but it was not. So I just asked, out of curiosity, I went into past history. So I asked about her any past history. So doctor very quickly said, ki, doctor, throughout her life, whenever she used to menstruate, she used to have headache. I asked anything else. So she said pain in the calves with no modalities. Like anytime my mother used to say, "Hey, mere pinliyon mein dukta hai," but that's it. That was the history which was available. I gave the remedy. Okay, I repertorized the case. I gave the remedy, and I called her on 21st of December. Just go ahead. Next slide. So see the thyroid reports. Now the TSH has come down to 3.9.
Dr. Tushar Joshi, please
Okay.
mute yourself.
Yes, yes.
Please go for it.
So her TSH has grown drastically well. Okay. Now the allopathic physician there also was very shocked how it could be. Okay. Then we have two videos there where her swelling, like Dr. Praveen showed her neck. There was a swelling on bilateral swelling on both sides, which then came to the left side, and then it went away, and only normal things were seen. Normal neck was seen. Okay, and this is the report. Okay, then follow up on 21st December. This was the case. Okay, and again on 6th January, we did the report. The doctor did not trust it. The allopathic physician did not trust it with the reports. She said, no, you have to do it again after 1 week, because maybe these reports are something showing some abnormality. Okay, the allopathic medicine was completely stopped, and this is the Last on 6th January 2021, means 1 week back, she had come to me with the new reports, and just see the reports. Okay, her T3 was normal, T4 is normal, TSH absolutely normal. Next slide, please. Now we'll think about the creatinine. Never we discuss about the creatinine. The creatinine went up to 2.02. Now for me, at the age of 75, up to 2.5, everything is normal. Okay, and if it also has increased, now the earlier report to her was 2.52. Now it is 2.02. Again, if it is again 2.5, for me this will be normal, because age-related process we cannot do much. Okay, and she's on already on so many allopathic medicine, antihypertensives and all. Maybe that could be creating a problem for her, we don't know. Okay, so next slide, please. In the second
It's
video,
a
which
it's a next
it's a video.
case. Oh, what's the video?
No, it's a video. So I'll just tell the gland first initially was bilateral, then it came to one side, and then again after 1 week, totally it got away. Means within 1.5 month, the whole neck was normal, and the allopathic doctors were shocked. They were about to go for operative procedure, which they had to plan within 15 days. Okay, they were planning about in 15 days to go for operative procedure at for a lady who was 76 years old. Maybe she may not get her fitness to go undergo surgery, but still they were insisting to go for surgery. So second case, second video, I'm very sorry that I could not share this video. Next case, please. Next slide. Next one. The third video is her neck is very normal. So this is my repertorization. So as you can see, neck goiter. These are the symptoms which I take. The first taken, the first remedy came was lycopodium. Second was iodine. Okay, so I preferred going with iodine, and I gave iodine along with iodine. I went for one more remedy, and for local and pathological repertorization. Sometimes in where I need to go with, like, we have a race sometimes. If doctor you can show us the result, our operative procedures can be avoided. Like I had last month, I had a case of 73% heart blockages, where they were planning a angioplasty to some young guy who was 23, hardly 23, 24 years, heavy smoker, where I came to a remedy like loxodanta, and within a month all his allopathic medicine has been stopped. Today was his follow-up. Single remedy, single dose, few doses, 4 dose AD2BD and SL for 1 month. And he did extremely well. Now here, if for where we had a time of 6 months, so I don't prescribe some pathological remedy or some biochemical. I don't do in such cases where we have ample of time, but where we have to win the race, like after 1 month they are planning for a surgery or something like that, which might not be very true. Like after, if allopathic doctors don't give fitness to that lady, 76-year-old lady, then they are helpless, they are handicapped, totally handicapped, but then too they are insisting on such thing. So this is a result of then my slide, please. Yeah, so for I thought to go with some other remedy also. So next slide will be for pathological prescription. Here I added thyroidinum 3x also, I mean suppose 6x. Yeah, next slide, please. Thyroidinum 3x, TDS. First for 2 days I gave iodine TDS for just 2 days, and then thyroidinum 3x for for next 15 days. And next time when she came, it was thyroidinum 3x only, no other remedy. Iodine was repeated. But while studying this case again, I thought I wouldn't have given thyroidinum, it would have been worked much better. But the size which drastically reduced, I think so it is due to thyroidinum only. So this was my first case. Any queries regarding this, you can please ask me. Dr. Praveen, is it okay? I'm going with the
Yes.
second case.
Yeah, you can go with the second case, and I would like to just half a minute. I would like to add it into that. Once
Yeah,
if you have a hyperthyroidism, or if you have a chronic case of any kind of a thyroid disorder, there must be a disturbance at the adrenal gland too. And once there is any kind of a disturbance at renal hypertension, that can develop the renal failure. That also happens in this case because of the creatinine level is always high. So it's a beautiful case.
yeah.
You can go ahead for the next case, Dr. Shakeel, please go ahead.
See, whatever Dr. Praveen has covered in his theory, like central disturbances, pituitary, again that renin-angiotensin mechanism. Now, if I would have been right in my first case, my paratha would have been a right remedy. She wouldn't have
Yes.
come with this thing. Now, after this remedy, she's still better. I called her today because I wanted to say the fresh words about her. She's absolutely fine. She's eating well. Her sleep pattern has been improved.
Great.
She's drastically doing well within 1.5 months, and the doctor there said there is no need for any surgery now.
Wow.
Okay.
Homeopathy has a great potential. I hope we
Yeah.
can go for our next case now.
Yeah. Next slide,
Yeah.
please.
Yes.
So this is a very short case. Case number two. Next, please. So this is a mail of came to me on 28th of March 2020, means last year, 10 months back. There is a testimonial video where he'll explain. I'm extremely sorry I could not send. I was not knowing. I just thought it might be just a PPT which Dr. Praveen wants to share, but no issue. I'll will continue. So he said ki, uh, when I asked him ki, after homeopathic medicine, how do you feel? He said ki, my life has been absolutely changed. I don't get my previous thought which used to come to me, and now I'm doing good in my business. He has an handicapped child. He does not worry much about him. He is mentally, physically handicapped. He has two children, and they both are abnormal child. So abnormal children. So without this, and he's a big businessman. He's into construction in Bombay. Think now how big he must be. So he's doing extremely well, and he has been to 2 3 or stalwarts homeopath earlier, and then this case later came to me. Okay, so it's a very short case, again scarcity of symptoms. I'll insist, if you are getting the totality, like how Dr. Pramin beautifully came to a remedy. I remember one of my case where there was a young girl, 16 years of age. She had a feeling of being caught, not able to move. Okay, thyroid was not allowing her to move, and the totality came of the anacardiaceae family. I gave Rustox. She was on 225 milligram of Thyronorm per day, and since last 1.5 years, she's not taking a single remedy. Rustox at an interval of 2 3 months, 200 BD. She's doing extremely well. Nothing like that. But sometimes you don't get cases. You don't get totality like in this case. But again, I'll go with this. A slide earlier, please. So this is a case of thyroid cancer. Okay. Um, uh, So this is a case of thyroid cancer. Already thyroidectomy has been done. So he is on modern medicine. So one Theranom 150 microgram per day he is on. Uh, Calcium supplement, vitamin D supplement. Next. So known case of CA thyroid gland. Now metastasis to lung. Okay. So think of the pathology now. Now think of the all the description which Dr. Praveen has said to you. See the central disturbance and see the spread, see the metastasis. Now see what to do with the case. Now presenting complaint, the patient, he is an elderly aged man. Now he says, I have gas, I have acidity. Now I don't know what is the difference between gas and acidity, but again I have written on my case paper also and here also. Yes, he says, I have some problem in breathing. I have severe episodes of attacks since 2016. I have been operated for thyroid. Appetite is diminished, no much desire to eat. So I asked him explain this, because for me appetite, sleep, thirst, this comes to rescue to you sometimes. So on detailing he said, on detailing he said, I am a very scheduled person. I eat 3 to 4 hourly, and in ample quantity. So I don't feel hungry only. Okay. So there was nothing in this case. About thirst, nothing specific. He said, I keep on drinking plenty of water. Then again, sleep. He says, I wake up at 3 to 4 hours. I wake sleep. He wakes up at 3 to 4 a.m. Suddenly, no cause and no complaint. I asked for urination or for something else. He said, no, I'm okay, fine. I get up. So we have namaz at 4 o'clock. So I said, sometimes I get up at 4 and I offer namaz. I don't have any complaint, but I thought it is necessary for you to mention. So I mentioned. So I asked about any sort of anxiety. Now see for any mental switch you are getting. Again, he's not ready to talk at all. He's talked just single word. So single word. You ask. He himself told me first few things, and I just interrupted and asked about details. I just detailed about the sleep, about the appetite and sleep. So he said कि क्या टेंशन हो सकता है इस लाइफ में. आई एम इनटू होटलिंग एंड कंस्ट्रक्शन एट दिस लेवल. तो इधर से पेमेंट आएगा, उसको देना है, उधर से आएगा, इसको लेना है. लाइफ में यही चलता है कि बच्चों का टेंशन है. तो आई सेड एज अर्लियर. So there is nothing specific, which is a routine he is talking about. Okay, next slide please. So he says, I think my thoughts wake me up I'm a businessman. What thought I will have in a construction and hoteling? You know everything. I said I don't know everything because I'm not into hoteling or construction. Okay, but this is a case. This is how the patient comes when there is an advanced pathology. Okay, so I then inquired into his dreams. Next slide, please. See how less this person is talking. Huh? So dreams, nothing specific. Stool, constipated and unsatisfactory stool. Sedentary life cycle, he said, whole day. So again, we don't get any modalities from here. Flatulence in the morning only. This is what gas he explains me. Urine is very normal. And now he gives me a very particular symptoms. Nausea when I'm fasting in the month of Ramzan, and after Seri when I sleep and wake up, I feel like nausea. Now this is a symptom which I suppose everybody feels, because you wake up at 4 o'clock. This is not a scheduled time to eat. Then you eat to your appetite at such a time because you have to keep be hungry at night. So I suppose if again after waking and again after namaz you sleep, you wake up, definitely you will have a bit little nausea because you have not exercised, you have not worked, you have eaten to the appetite. Again for me this is a common symptom, so I never considered it. And he said कि मजा नहीं आ रहा है लाइफ में, किधर 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 भी मजा नहीं है, कि कुछ enthusiasm नहीं है लाइफ में. I asked the detail about it. He said कि routine life again वही किधर से पैसा आएगा, उधर देना है, उधर से आएगा. Now to consider it to some part, put it somewhere कि anxiety business, the weightage was not coming. Like उसका अंदर वो weight नहीं था. वो केस में उतना दम नहीं लग रहा था. It was just a casual talk which was going on with me and with him. Okay. So then I just opened his file because no symptoms I have. 3 radiation. Next. One more. Yeah. So he has already taken 3 radiations. And then he has come to me. And at that time when he came to me on 7th March 2020, means this report is when I gave the remedy. Okay. So his T3 was this much. No, this is before on the day of the case taking. This was the last report which he has done. So this was his thyroid level. The 3.9 is a higher level in spite of taking radiations. Radiations means he takes radioactive iodine and plus this medicine. So 3 sets of that has been already done. And in spite of that, his levels are not much. And in cancer cases, thyroglobulin is the thing which has to be taken care of, not this level. And this TSH has to be always below 2. It is good that it is below 1. It is very good. The prognosis is better, but below 2, it is for allopathic doctors. Below 2, it is normal. If it is increasing above 2, they increase your allopathic doses. If it is 100, they make it 125. If it is 125, they make it 150. So allopathic point of view, according to modern medicine. So in CA thyroid, the management is up to 2. It is good, but it should be below 2. If it increases above 2, they increase the allopathic doses. Okay. Then I collected few reports. Moderately increased metabolic activity, active disease seen. Again, the disease is appearing, as well as a defined soft tissue lesion. Again, means from the residual part, again the disease is appearing again, and mildly increase in metabolic activity in the upper part of the lungs and in bilateral way. That is lung metastasis to lung disease. This report was done on 8 February 2020, and this is the reason for CA. The one of the courses which I have done is mistletoe cancer cases, where I see cancer cases also. So listening, one of his relative, they were better with my treatment, so he was referred here, Kyudar Majja, and he came to me not for thyroid, he came to me for metastasis lung. Okay, now but this is not the case. Whatever he comes for me, it's not important why he comes and from where he comes. This is the report. Okay, so the case was finished there. He is not talking anymore. Okay, next slide please. Nothing, no more symptoms. You probe him, nothing weightage, just he gives common symptoms. Okay, so now we'll just look at the analysis, how to work out on such cases, what to do now, what to treat in this patient, whether
Dr.
I treat
Shakeel,
his
sorry to
cancer.
interrupt. Dr. Shakeel,
Yeah,
we have
yeah.
we have 1 minute 30 seconds, and after that we are going to rejoin again to finish the case. Okay, you can continue now.
Yeah, yeah. Just let me know when it is finished now, because so again I'll just start again. What to do with the case? Now you don't have any symptoms, just now what you will treat. Patient has come for the cancer. Again, it is a metastasis. Respiratory complaints, whether they are common, because you're not getting any modality. He has said कि मुझे एपिसोड्स आया था और उसके बाद वो मालूम किया, रिपोर्ट किया तो मेरे को कैंसर डिटेक्ट हो गया. तो डॉक्टर ने बोला है कैंसर का अलार्मिंग सिम्टम है, बट ये स्प्रेड वगैरह नहीं है, एक्टिव फेज में नहीं है. लंग कैंसर, यू डोंट वरी अबाउट इट. व्हेन यू विल हैव a bit increase in the cancer, we'll see to it. or we'll, when you view radioactive iodine, we'll see there what we can do. So he was on a hold. Okay, then acidity, which is a little bit of worry for him. So let's see what we can do. Next slide.
No, we will wait for a few seconds and we will rejoin again. Okay.
Okay.
Yeah, just a second. It's request to all the participants, please rejoin again, for we have to finish the very interesting case of cancer of thyroid, and it's a very interesting case. I hope so you all people can reach up to the exact remedy. So be fast, type your remedies in our chat box, and the people who are right, who can reach to the remedy, we will give them a very good price. We will courier you the price. Okay, so type your remedy in chat box, whatever the understanding you have, and we are going to rejoin again.
Alamukti.
पढ़ना नहीं चाहिए फक्त
Go ahead.
जा किती सांग कितीला झालो की
Dr. Firoz. It's request to all participants, please mute yourself except Dr. Shakeel. It's my humble request to all. Yeah, Dr. Shakeel.
Yeah.
Go ahead.
So again, just again we'll restart. What to do with the case? What to treat in the patient? Whether cancer, whether metastasis. This all questions comes. As Dr. Praveen wisely said, you should have the answer of why. Now here you don't get any history. You're not getting anything. So here question is what? If you're not getting answer to the why, you have to think what now. What I should do in this such a case? Where you don't have a symptom, when we don't have anything. So I just thought, just wait, we'll do something. Okay. So next slide, please. I asked him what affects you the most. So very important question. If you could help me with my acidity. So he just gave a good, beautiful answer. Now in this case, I suppose I thought he will give a good history about that, and I can go into the go in the depth of this acidity. And since I was fearing that he will not give any symptoms, because he was not able to answer anything. So he said, I said, explain what is acidity for you. Then he gave me all common symptoms of acidity. Now, common symptoms means like common symptoms which are common, like burning, eating, burping after eating, okay, empty stomach, burning, all that. Now, for me, for whole listening to, all of a sudden he said, except burning, this my burning, ये जलन जो होती है ना, ठंडा खाने से अच्छी होती है और गर्म खाने से बढ़ जाती है. This struck me like anything, okay. So I thought maybe this could be particular for this case. So rest all were the common symptoms. Next slide.
Okay, so in next slide there is a remedy selection. I know there is a repetition. So it's request to all the participants, type fast the name of remedy. Somebody write about Naxomika. I don't know the name. Other than that, Dr. Upma, Dr. Arshi, Dr. Ram. Other participant, type fast. Send me your remedy in your chat box. What are you thinking? Dr. Ram said Kalika, very good. You are quite closer. Dr. Asta Balani said bryonia can be a remedy. Okay. Type in chat box. Please type in chat box. What about others? Be fast. We have not so much time. So okay. Let's see. Yeah, Dr. Meenakshi said Kali iode. Very good suggestion. Kali iode is also important remedy for cancer of lymph nodes and all that. Good suggestion, Dr. Meenakshi Ratnabal from Borivali, Parikandivali. Yes, Dr. Vijay said also Kali iode. Anybody else? Dr. Shakeel?
Yeah.
Shall we open our box?
Yeah, sure.
बता दे क्या है?
हाँ जरूर.
Okay, fine. So here is the PPT of remedy selection of Dr. Shakeel's case. Yeah.
For me, this heartburn, jalan is heartburn for me, and it is aggravated by warm drink. The only remedy is Aristolochia clematis. Now, I request you all to just go through this remedy. This is well explained by Dr. Farooq Master. It's also available on Facebook. Okay, he has explained wonderfully this remedy.
Can you repeat the name of remedy again, Dr. Shakeel, please?
Aristolochia clematis.
Aristolochia clematis. Okay, great.
Yeah. So this is the remedy. For me the PQRS was burning, aggravation by warm drinks. Okay. Now next slide, please.
Dr. Nilima, please mute yourself.
Now again, for me, this is not a simple thing. Okay, now we have to, in my mind there are two, three, four things going on. Aristolochia clematis is a good remedy. The time when I gave this remedy, I was knowing the better remedy. I just read after a selection of every remedy. My procedure is to read the remedy from two, three books which I constantly refer, like Fata, other books also. So I was just happy but not so happy to be with it. So other question was, what about the metastasis? So initial stage where I was with Dr. Sujit in some certified courses, he used to give ruta for prevention. So I just said, just give 6x ruta and Aristolochia clematis for 2 days and just we'll see. Next slide, please. So expectoration, which was not there, has started better after expectoration. So he was not that expectoration was not there initially. Now it is there, and he complains of tiredness now. Okay, so I repeat the same remedy on the 11th. For me, he's better. So he's expectorating. Discharges are coming. He's better. Now on 1st May, he comes to me 2020 and he says, "Doctor, everything is better except my tiredness." Okay. Now I said, okay, na, abhi itna bada disease hai, sab acha ho raha hai, तो it's good. We'll continue the same, na. Okay. So I gave the same remedy and he came to me a month after. And see now. He comes and tell doctor, baki sab to theek hai. You do something of my weakness, tiredness and tiredness. I said, you're 95 kg of weight, which is, it's already tiredness maybe due to that, and he's already, taking thyroid medicine. For me, it was normal. So, but he insisted me. I said I should give some weightage to it. Okay. So weight is 95, not reducing. He is doing lot of diet, lot of exercise, slight exertion also. His heart rate increases, and he also complains about the weakness of the memory. And this is, listen to this. This is very important. हमेशा बीमार लगता हूँ, कमजोर लगता हूँ, लाचार लगता हूँ, हमेशा ऐसे थका हुआ लगता हूँ, कुछ नहीं कर सकता हूँ. And this time I said कि ruta is not the another part which has to take come. I have to take care of this remedy, this tiredness in separate. Now for me, this analysis कि whether I should be with my Aristolochia clematis or I need some supplement to help him out. So this was not coming to my mind anyhow. Then I repertorize the case. The repertorization I have not put here, but anybody who wants to see the remedy can read Boric and also Fatak, where the explanation of this remedy he has given wonderfully. Okay, so I gave him thyroidinum 30C. I gave him thyroidinum 30C. I gave him Aristolochia 30 TDS for 2 days on 3rd June, followed by thyroidinum 30C BD. Okay, repeat it. Now on 31st August, see this. His calcium level is 8. Next slide, please. Now his serum calcium is 8.53. His anti-TG is 20. And his thyroglobulin, which was more than 150, 170, has come down to 56. Okay. Next slide, please. On 3rd December, 2020, see his TSH. I said less than 1 is more and more good. Okay. So this TSH level 0.08, 0.08, T3 and T4 are absolutely normal. There is slight coryza, no significant modalities. For me, after this is my experience since last so many years, and I'm treating, like we in our college days we used to study any treatment. After that, when the skin eruption comes, it's a good sign. But when I see such pathological cases, I have often seen in my practice, the patient has coryza with no modalities, and it is hardly for a few minutes or an hour of a day, and then it subsides on its own, and it doesn't trouble the patient. In fact, patient feels good in spite of that coryza, feels light. So this is my experience. So he said, I'm having coryza, no significant modalities, no fatigue, no weakness, no any complaints. Now waiting to repeat PET for CA. Hopefully it should be better. Now he consulted a day before yesterday. He consulted. His radiation therapy is due since last 4 months, and doctors are still postponing it because they say such a wonderful reports, and we don't feel any necessity to go for this therapy. Again, he has been called in the month of February next month to analyze with PET CT. So I just wrote that waiting for her PET CT CA. Hopefully it should be better. And his weight has come down to 93. He's doing extremely well. Day before yesterday only, I called him for the testimonial to share. He has started one more good business in hoteling. He has started added on to his, and he's doing extremely well. He is putting his energy towards his children who are abnormal mentally and physically. He is taking them to the counseling classes, which he used to not do earlier. He is more enthusiastic in business, and the troubles of यहाँ से पैसा आएगा वहाँ देना है वहाँ से आएगा देना है, no more troubles him a lot. So this is my case. Thank you for having patience and listening. Next slide, please.
Yes.
Thank you very much.
Yeah, it's
I
a
prefer
wonderful, Dr. Shakeel. You have shared your wonderful cases, deep pathological cases, and so it's very very necessary to understand all the homeopaths that homeopathy has such a potential. We can treat any kind of a disease, but before that we must need to treat the central disturbance. So CA cancer and the first one case also beautiful, but I would like to give some suggestion from my side as per my experience. Along with the cancer of cervical lymph nodes, there is another important remedy is the cistus canadiensis. Okay, and if also there is a cancer behind the neck or that thyroid gland, the another remedy is kali chloride. The kali chloride is also important remedy for endocarditis or cardiovascular disease. But especially if there is a cancer of cervical lymph nodes, especially the cervical lymph nodes, there is kind of a lymphadenopathy. Then think of cistus canadiensis. We can say also it's a Hodgkin's disease. I think so. But it's a wonderful session, Dr. Shakil. Congratulations. And thank you so much being here for all of us. I think now it's the time to go for question and answer session. Dr. Vinodini, are you there? If you
Yes, sir.
if you
Yes, sir.
if you have noted down some questions, so please,
Yes,
it's a time to go
yes,
for
sir.
question and answer session. Go
Yes,
ahead.
sir. Sir, there is a query from Dr. Meenakshi ma'am to just share the repertory sheet of Dr. Shakil sir's first case, sir.
Okay, fine.
By
Okay, I
text.
will I will I will, I will share that. What else? I'm going to share this. What else?
Yes, sir.
Any other question?
Many participants are having queries regarding the dosage and the first case, and natramure case, sir.
Natrum cases. Okay, fine. So the potency was 1 m and it was in repetition weekly one dose. Okay, so after that that doses was reduces step by step, and once her hypothyroid level was thyroid TSH was normal, then all the doses was not all the doses was stopped there. But I would like to give another suggestion also, as you was talking about my case. One of the best remedy for the colloidal goiter is calcarea floor. There is given in Mantra Medica in repertory. If there is a goiter, especially the colloidal goiter, the remedy is calcarea floor. Yeah. This is the doctor for Dr. Meenakshi Ratnapal. This is a sharing of repertory chart of first case of Dr. Shakil Mulani, and this is the second chart. So from Barata carb is prescribed on iodine along with the thyroidinum. The thyroidinum is also one of the best method which we can use in any kind of a thyroid disorder. Okay. Along with that thyroidinum, also another remedy which is also important, that is cortisone, which we can also use as a important for any kind of a thyroid disease. If you are not able to reach up to the central, that kind of a core. Yes. Next question, Dr. Vinodini.
Dr.
Sir, we
Praveen,
have
I would
one
like to
more
add,
Yes.
but yeah, I'll request all the audience. This is nothing like that if you can reach to the core of the disease,
Yeah.
like Netramore. This is the wonderful thing, you need not change your remedy only. On single remedy, patient comes out wonderfully. It's wonderful to see that.
Yes.
I out of my, if you ask me, out of 10 cases of mine, this is 1 or 2 cases I do such things, but 8 to 9 cases I come up with a single remedy, and this is a wonderful process to see. Life changes. There are
Life
many
changes.
deep changes which happen. People start looking at the life in a new way, because
Yes.
thyroid is not such an easy to see, and to the people who are witnessing it may know it very well. So I'll request all the audience, search for the totality. That is the best thing. Okay, showing the result, and that this is, to me, it is a bit little fantasy. Best
Absolutely
is
right.
get the totality.
Yeah,
Best
so
is totality.
that's why I shared the disease symptoms and the patient symptoms. So we must need to take the patient symptom. In the disease, how he behaves. In the disease, how he reacts. And in this disease, try to find out both the polarities. And then you can try to take the rubrics which is of the patient, not the disease, or not the disease symptoms. This is very, very important because in renal failure, you will have the same symptoms. In ascites, you will have the same symptoms. In thyroidism, you have the same symptoms. Even the diabetes, you will also have the diabetic neuralgia. So some symptoms are like common, but you must need to understand which to take and which not to take.
Yeah.
Yeah. Any other question, Dr. Vinodini?
Sir, no, sir.
Uh,
Participants, if you have any queries, kindly drop them in the chat box.
Doctor, somebody.
One link I could like to ask, rather than put it in the chat, I'm Dr. Archie. So I wanted to
Yes.
ask, when many people when who approach us for thyroid cases, they would not like to stop their, the thyroidinum or whatever medicines they are taking. So what do you advise? Yes, when, obviously we would tell them not to, but if they're still taking, how do we manage these doses?
Yes, absolutely right. So what we can advise, so the first thing, the physician must need to show that kind of a confidence to the patient that don't worry, you have to stop all the medication whatever you are taking for the thyroid. If patient is not agree, then at least you can advise them to taper the dose. So whatever the thyroid, thyroxine or thyroid she is taking daily, you can advise her you can take alternate a day, or then after that you can advise them to take like after 2 days. One thing which is very, very important, I would like to suggest tell you here, whatever is the medicine patient is taking, but if our homeopathic medicine right now, it will act at anyhow. Why I'm telling you, I have seen many cases of ICU cases. Those are in coma. Those are taking antibiotics and many, many medication. But even after our single dose of medicine, if it is right, if it is exact minimum of that patient, it will definitely has to act. So same wise, if patient is not able to, switch off that medication, it's don't worry about it. Not in first sitting, in the second sitting or third sitting, the patient will definitely going to stop all the medication if there is a right minimum, because patient will get all the reliefs and all the good kind of a prognosis in the case. So I think it's very, very important. But try to be give that kind of a confidence to the patient. Stop all the medication of all thyroid. It can be a new marcazole, or it can be a thyronorm or whatever. Stop the medication. Don't worry, nothing is going to happen because tablet thyroid is not a medicine. Okay. Ultimately, they are
Can
giving the nosode, whatever we have, like thyroidinum. Am I right? Nothing is going to happen. Don't worry.
can I share? Can I share my
Yes, yes,
experience?
yes, Dr. Shakil, please, why not?
See, normally when thyroid patient comes to me, so I just see about the general situation, like at what age and what stage he has come to me, or he has come to me. For males, though, normally it is like just quit and be with me. You'll be all right. For me, females, like if they are concerned PCOD with thyroid and not conceiving, menses are irregular. Okay, for them, my approach is like if the family is complete, they have kids and everything is okay. They are into late 30s or for early 40s, so for them my approach varies, like normally if they are eager to conceive, so I don't ask them to stop the medicine directly, rather I advise them to taper it,
Imran,
as you said.
सही हो प्लेट में निंद्रा आई है
Gulam Saab,
So
mute
I
kariye
ask
please.
So I asked them to just taper it. Like if they're on 100, after 2 3 months, I put them to 87.5. After 2 3 months, after doing TSH normally, I put them to 75 again, like gradually as per the symptoms, like our regular cycles, because they're eager to conceive. We cannot we cannot put the patient, if the medicine has been stopped abruptly. Sometimes the cycle gets disturbed. Okay, then it sometimes happens. So for me, I normally do is ki I gradually taper. But once the family is completed, everything is okay. Nothing to like, nothing more concern in the life. So I ask gradually. I ask them stop. If they are not allowing, 60 to 70% people are ready to stop the medicine, but 30 40% who resist, with a very fast dose we can cut down easily, and they are very happy seeing the reports, because many people like they eat medicine for 20 years, now they are used to that, becomes a part of their life, so they will
Yeah.
not easily give up. They, once they get up before going to the loo, they go to the thyroid tablet they take it and then they do their next work. So doing this for 15 17 years, this becomes a part of life. So to, and my experience is ki when you ask them to at least reduce na, for at least 2 to 3 weeks. They come with the complaints which are not significant, but all are thyroidal complaints, which are not significant, which has no weightage, which has no modalities. So you have to judge your case according to the intensity of what she wants with from you. Whether she's having a family, it's complete, and she wants to get rid of the tablet. That is the another approach which directly you can advise. Or if she has some other things to deal with, like joint pain, her weight, her obesity, her PCOD, she wants to conceive in the life, she has to go ahead. Okay, so this thing here comes to me, then I gradually taper. I don't go do it very abruptly. But again, as you said very truly, if your remedy is right, anyhow your the allopathy medicine has to go away, the modern medicine has to quit. The case I told about in my case was like loxodonta, where all allopathic medicine, all antihypertensive, all anticoagulants were stopped, blood thinners were stopped, not anticoagulant, blood thinners were stopped. It happens, but when you're right, it happens. And
Yeah,
the modern medicine doctors only will tell you, you just now it's not required.
yeah.
You're
Even
lucky,
I
they will
would
say
like,
you're
yes, I would like to add one more thing important, that as I said you that because of thyroidism, because of hyperthyroidism, there is a disturbance in metabolism. So I always ask, tell the patient after the medicine might be, maybe your urinary output or urinary output will get increased. Along with that, into the next menses, you will get heavy menses and can be there can be clots in that. Because why I'm telling you, most of the cases get misdiagnosed with, along with the thyroid problem, they are not able to get menses, and for that also they are taking another medicine. So along with thyroid profile, you must need to go for also to look upon the PCOD profile, because there might be kind of a problem in LH, prolactin, FSH, and all that. That can be also reason to not to get conceived. Okay, so this is very very important. And another question by Rohini: when single dose is given in chronic case, how will know it is the right treatment? So both of the first changes will happen at the mental level. Along with that, you can ask the patient about their general condition, what about the appetite, what about the sleep, what about the stamina, you know. And once you have that kind of a positive response at at their mental state, then you can understand our remedy is right. You can go ahead with that. If there is no after changes at mental level, means your medicine is not right. Okay. Yeah, Dr. Arshi,
Sir,
you
there
want
is
to add
one more
something?
query also, sir.
Yeah.
Sir,
Yes, Dr. Vinodri, tell me.
sir, there is one more query in the chat box, sir.
Yeah.
If we have to repeat the same remedy, then should we continue with the same potency or go for another potency?
Yeah, very good question. Yes, Dr. Shakil, you want to give answer?
first, I suppose you, then I'll tell.
Yeah, okay, fine. So most of the cases I would like to, try to understand what is the level of disease. It's a pathological or it's a psychosomatic. Okay. So once in thyroid cases, if patient is uh, uh, did well with the same potency, you need to be with the same potency first. If that kind of a diligence or that kind of a anger or that kind of a uh, get reduces, so must be we are going to select the remedy as per the levels, fact, name, emotion, delusion, energy, and all that. If patient is coming down, you can reduce the potency. Otherwise, you need to be on the same potency till the report comes normal. Okay. So for the potency selection, there are different understanding according to their clinical experience. Okay. But I try to follow according to the levels mostly. Yeah, Dr. Shakil.
Okay,
Yeah,
sir.
this is the best thing. The the disease at which the level at which the disease is experienced by the patient. For me, I select the potency on that basis. Again, one and the same. What you told is right. So what the experience of the patient, depending upon that, our potency should be. Okay, we take a good case, but the disease is very pathological. You have to correlate between that. The pathology and your state has to be very perfectly matched, and then you can give. Sometimes good results are not we don't get good results only because of the potency, because it makes a vast difference. You have to treat like pathological cases. You have to be very sure about your potency. But where you don't have very gross pathology, uh, you can think anything.
Okay, fine. So I would like to end the session with the words of our classmate and very renowned homeopath from Mumbai, Dr. Arshi Tank is there from Goregaon. So Dr. Arshi, please have a word about this session. Dr. Arshi, are you there?
Yeah, it was a wonderful session. And yes, I'm there.
Yeah, thank you
So
so
today
much
was
for
a
joining.
wonderful session. Thank you, Praveen, for organizing it. And thank you, Dr. Shakil. See, and especially because we got to see different aspects of how this can be, how, this is very challenging. I know for, endocrinal disease disorders are very challenging for us to cure. Also because at times we are not even, like Dr. Shakeel says, we have challenges with the prognosis. We do not know whether the patient is improving or not improving, even if it is diabetes or, and like endocrinal diseases. So we are not sure, whether at all times whether our disease, our remedy is on track, unlike other symptoms where we can see the symptoms which are guide to us. Here it is very difficult to ascertain. And especially in Dr. Shakil's cases, what I liked was there was such a, it was so difficult in the sense the symptoms were not hardly there. You do not know where to start and what to prescribe on. I know it's very challenging when we do not have the patients or an accurate symptom. So we are like, going into a, forest or whatever uncharted territory. We don't even know where we are going without a compass. But here he could actually, from a very small symptom of acidity, he could just pick the remedies. So for here, for the learning for me was, from a very tiny, symptoms, whatever small things are there right in front of us, we are always in this quest to keep looking. We are hunting for symptoms and, testing the patients, and we, in fact, in this quest, we forget to see which is right in front of us. The patient is telling us about his acidity, he's telling us about all his symptoms, and we are, okay, keep that aside, and we are looking for more and more symptoms. So the beauty here is in the simplicity. What is there in right in front of you, you just take that, and then you can start working with whatever is available. Even if you do not have anything, at least what I learned was that even with a simple iodine, or, which are basic, fact level remedies, there can be there is a possibility of cure. Of course, we know that the constitutional will have amazing results, and it is a very great thing when we get a right constitutional, like in Praveen's case. But here the learning was, both cases were very good learning. Thank you for a wonderful session, both of you.
Thank you so
Thank
much.
you so much, Dr. Rashi, and thank you so much for all the participants from all over the, you know, India and also from abroad. Dr.
Sir,
Robin.
there is one more.
Yeah.
So sorry for interrupting,
No,
sir.
no. Continue.
So there is one more query in the chat box, sir.
Yeah.
What is the expert opinion about hypopituitarism, sir?
Yeah. Absolutely right. So we have many cases of pituitary adenoma, and also we can say the hypopituitarism. So I would like to say, along with your constitutional remedy, you must need to go for nosode. Nosode can help very well in this endocrine disease if you are not able to reach to the exact minimum. But there are also wonderful results. We have many cases like this, and hopefully, along with your, if you feel so that next session should be on that, we will try to arrange the same session on that also. Yeah, Dr. Shakil, would you like to add some words in that about the hypopituitarism?
Yeah, I have 2-3 cases of hypopituitarism where, I was able to collect the whole totality, and I have given them a constitutional remedy. The patient, after in a span of 2.5 years, were off all steroidal medicines, and they are doing good, except one of the patient which collapsed during COVID. But it's not. She was very wonderfully doing very well. Even sometimes I would like to share that case. Wonderful results. Constitution, I don't know. I have not used steroid or not nosode or sarcot in that set. All 3 or 4 cases which I remember. So they are done good on constitutional single dose. I repeat once in 2-3 months, once in a month as per the requirement. But they are done very well, very well.
Yeah. Also, we have international participant, Dr. Robin Pollock Daniel. She's from Toronto, Ontario. So, hello, Dr. Robin. Would you like to have a word with about regarding this session? Welcome you. Dr. Robin, are you there?
Hello. Yeah, of course I'm here. What's your question?
Yeah, my question is
Why are
that
you picking on me?
you have to add some words about this session. I hope you are there since long, and I hope you enjoy the session. But can you tell me something
Of
about your
course.
learnings? Can you tell me something about your learnings because you had joined from Canada?
Today?
Yeah, please have some words
Sure,
about
I'm
this session.
joined from Canada. I wish we had more people from Canada joining. I'm not seeing, unless some of the doctors
Yeah.
here have moved to Canada. So I will try to spread that to my colleagues. because I agree. I like the fact that one of the cases was more of a constitutional case, to use the bad word. A lot of my colleagues don't like the word constitutional. And I like the one that it's more organ specific, so that there's a variety of approaches and that we should all benefit from. You know, at times we should zoom in on the seat of disease, and at other times we should consider the totality of the patient. So that's a very good learning that you gave to us today.
Yeah. So thank you so much for joining. I hope so the same support for in future. And hopefully Dr. Smita Mahajan and Dr. Annabelle Menendez also, we are trying to arrange the sessions for all the colleagues and all the friends from Canada in future. So thank you so much, friends. Thank you so much for joining. Hopefully we will see you again in the next webinar. Thank you so much. Bye bye and take care. Bye bye, Robin. Bye bye, Dr. Shakeel.
Bye. Bye.